Hi, and welcome to Partnership Live, our monthly discussion with New Jersey leaders who are changing the paradigm in maternal health. Today, I'm thrilled to have with us Chanel Portia Albert. She is a phenomenal doula advocate. She has worked from Brooklyn to New Jersey to the White House. She has so many titles: activist, doula, consultant, innovative, mama of 6 children. She is changing the paradigm when we talk about advocacy for Black and Brown women, maternal health advocate. So let's talk about doulas. Let's talk about changing the paradigm. Let's talk about healthcare. So, Miss Albert,
Yeah.
tell me about ancient song doulas. First, let's talk about doulas in general. Some people are saying, what are doulas? Are they midwives? What can they do? Let's talk about that. And then please tell me about your organization. What are doulas?
Okay, so doulas, traditionally speaking, are individuals who go out into the community to offer support around someone who is expecting. And so we offer emotional and physical support. And when we're talking about Black, Brown, and Indigenous communities, we're also talking about advocacy, right? And so what does it mean to center the person in information so that they can make an informed decision about their care and what that means for them? And so we're guiding them through the process of their prenatal stages, right? Providing education and information, as well as assisting them in preparation for childbirth. We will attend the birth and stay with them the entire time. And then we will offer postpartum support. And so, going to check in, doing home visits, ensuring that they are centered in their own well being so that they can take care of their child. And that can be anything from, looking at maternal mental health wellness, helping them along with their 6-week postpartum visit, making sure that they go, um, ensuring that, again, they feel centered in their parenthood and what that looks like for them.
So it's really that advocate that you need when you can't really speak up for yourself, or you can and you just need that extra push.
Right. I mean, I think if we look at society and the ways in which community traditionally, was
Mhm.
focused around when someone was having a baby, you would have aunties or cousins or, extended family who was coming and supporting your mother, your grandmother. And, as time has progressed, we have really moved from this really community focused, community centered framework to something that's a little bit more individualized, right? Or,
Mhm.
you may live a farther away distance from your family. Maybe you're here and your family lives in another state or in another country. And so in understanding that, what does it mean then to get the necessary social supports so that you can feel grounded in what it means to be a parent? You know what I mean? When someone is having
Right.
a baby, there is no like automatic, download from the cloud and now all of a sudden you know what to do.
With all those instructions, do this and do that. Yes,
Exactly,
absolutely.
exactly. So this is that person who is coming in, who is offering that non-judgmental support and being able to guide them in a supportive way, without imposing what they think that they should be doing, right? Again,
Mhm, mhm.
offering them guidance so that they can make a true informed decision about their care.
So tell me, what is the spark? What really inspired you to found Ancient Song Doula Services?
That would be my first birth. So I'm a mother of 6 children.
Mhm.
And I had a wonderful home birth with a home birth midwife. I had a doula. And yeah, I started out with the OBGYN, and
Mhm.
she was a Black woman, and I thought that because someone looked like me, that was enough, right?
Right.
But it wasn't enough, because when my husband and I, when we would go for our prenatal appointments, we just felt like something was missing. This was
Mhm.
also a time where I was coming into my own motherhood, without a mother. Right. My mother had transitioned when I was 14 years old. And so there was a lot of different emotions around being pregnant and bringing a child
Mhm.
into this world. And I remembered when I was in my previous life, when I was a commodities broker, that, I had come upon this information of this, certified nurse midwife who, I looked her up, and, she was just offered incredible care, right? It was really patient centered. It was patient oriented. It wasn't just about a healthcare diagnosis. It also was about me and really getting to understand what were the different things that were happening to me, and how that reflected in how my birthing experience may go. And
Mhm.
so, yeah, I had a wonderful birth experience, and I ended up afterwards taking a doula training, and From there, when I started to attend births, I started to see the ways in which Black and brown women, in particular, low income, those who are on Medicaid, were disenfranchised within the system, right?
Mhm.
So I was coming from a place of privilege where I had private insurance, I could pay out of pocket for services. This wasn't something where I wasn't really thinking about like the other part of it. And then coming into a space where, I'm supporting someone who's on Medicaid, they're going to a free clinic. Their appointment's supposed to be at 9 o'clock. They're not being seen till 12 o'clock.
Right.
To be seen for 15 minutes, to have your questions be dismissed or not completely answered, to have like all of the energy directed at me as someone who's just there as a support person and not really, paying attention to the person who's actually gestating. Just the criminalization that I noticed at bedside, and just the dehumanization, right, of the experience. And so I put a call out on a listserv and I opened up my home. I said to folks, I said, listen, who is interested in serving this particular population of folks? Like, am I
Mhm.
the only person who is witnessing the ways in which people are being degraded in their healthcare experiences?
Mhm.
And about 23 people showed up to my house. And it just started from there, right? Because, I think like most doulas, you take a doula training and you think, oh, okay, I'm gonna like, start
Right.
and I wasn't really trying to start a business. Like at the time, my husband, he's working, he's a full-time teacher. I'm not thinking about all of that. I'm just thinking like, oh, I want to be able to help. And then again, like, after experiencing and being able to support folks, I was like, wait a minute now, like something's not right. You know what I mean? Like, why don't people know
Mhm.
that they have options? Why don't you know that you can ask these questions? Why don't folks know about insurance segregation? Why don't we know about what it means to select a provider, the differences between private and, and public care? Like, what that means,
Mhm.
And
Mhm.
so yeah, it started in my house and has just continued to grow from there. But again, it just started out as a passion and wanting to help, you know what I mean? Like really genuinely wanted to help.
So was there a defining moment? You said you were a commodities broker in your own life, that you were like, okay, I could do this. This is nice for me to do, on the side. But was there something that clicked and then it reinforced your commitment and you were like, I just can't go back. Like I cannot move forward. I can't see me doing anything else. What was that defining moment?
Um, what was that defining moment? I would say there were many different moments, and
Mhm.
they came in increments. Again, each time I went and supported someone, I started to see more and more just the way in which Black women were being disenfranchised. I started to witness just, there's conversations around like the school to prison pipeline, but we never talk
Mhm.
about the ways in which how someone is treated during one of the most sacred times of their lives, right? One of the
Right.
most vulnerable times of their lives, how
Mhm.
that has a profound impact on how you are able to parent, right?
Right.
Or not parent. All right. And so in seeing that and in witnessing it with my own eyes, I was like, I just was like, it brought me more joy
Mhm.
to be able to see someone grow into themselves, to see someone reaffirm themselves, to be able to question something and to realize that their questioning was coming from a place of just intuition and
Mhm.
saying like,
Mhm.
okay, I know that something doesn't feel right, but I may not have the
Right.
words to be able to articulate that.
Right.
Um,
Right.
and so based on that and just again, being able to support, it was just like
Mhm.
and then the 2008 recession also helped too.
It's like, aha, okay, that'll help. I am a labor and delivery nurse, and very much like you, I feel as though a lot of the work that I had been doing as labor and delivery nurse, and my mother was a midwife from the West Indies, it was very intuitive. So I felt like a doula the whole time, and then I became a nurse. So when I got to the hospital and it was very rote and there were things that needed to be done, I'm like, wait, but I got to support my patient. And there were things that I had to do that were just not in line with the, medical structured concepts that needed to be done. So I could completely understand. You're like, wait, this is not the way it should be. And you know intrinsically that there is something wrong. But the conversation that we're having now, they make it especially difficult for Black and Brown communities. And then you have the doulas are going to save the world. The doulas, and it seems like a lot of burden are being placed on the doulas.
Right.
How do you feel about that?
I think that's the wrong move to make. You know, I think we really need to lean into what it means to really centralize collaborative care frameworks. I think that the healthcare infrastructure as it stands right now is not suitable for anyone. If we look at healthcare providers who have traditionally played the roles at bedside, such as nurses, midwives, physicians, they are not getting the necessary support that they need in order for them to be able to be the providers that they want to be. Right. And so you can look at the doula as like, you know, I see in some spaces as like a Band-Aid, right? That's going to like heal the world and make it a better place when that's not the case, right? If we're not, we don't have a willingness to really address the necessary hospital protocols that are in place that, again, are not in service and in alignment with how, you know, if a nurse is overworked, if they like have double, triple shifts that they've been working, if, you know, it's one nurse to every 3 patients, if you are not necessarily getting the buy-in from, you know, the
The
staff,
policies and the people.
to be able to like adequately provide services. If you're a physician, you know what I mean? I think that, you know, sometimes physicians and others get a bad rap, you know what I mean? Where
Of
when we
course,
start
yeah.
to talk about when we start to talk about the healthcare infrastructure as a whole, it becomes like a blanket statement, like you all are doing this. And
Of
it's like,
course.
no, you know what I mean? Like, yes, there are instances where there are the individuals who are coming in with biases, right? That are projecting in the way in which they provide care. But there are also good intentioned individuals who I feel like if you are a person who have decided to give your life up to service of others, because that's what nurses, that's what physicians are doing, right? And that means that there has to be something intrinsically within you that says, I want to see the betterment of others, right?
Of course, you get up every day to do your absolute best. You're not getting up to be
Exactly.
like,
You're not there
I'm
to try
out for
to
this person.
intentionally cause harm, right?
Of
And so
course.
that being said, then we really need to look at the structure in and of itself and not lay blanket blame on individuals, right? Or individual provider types, and really look at how are we supporting the needs of the providers so that they can provide the services that are necessary to the patient, right? Because patient-centered care is not that. It's
So-
not what it needs to be.
So what do you feel are the most significant barriers facing Black and brown people today? There are a lot.
Yeah.
But what do you feel are the most significant for birthing people, and how is Ancient Song addressing some of those challenges?
Yeah, I think that it's you know, I think with anything you have to take a multi-pronged approach. I think first and foremost there has to be a de-siloing of the work. And so what Ancient Song tries to do and be very intentional about is looking and working across different sectors, right? And so it's not about us just you know, us training doulas and putting doulas out there in the world. It's like, okay, how are we formulating partnerships with other community-based organizations? How are we being intentional about creating partnerships with hospital-based institutions? And then how are we leveraging legislative policy, right, to really shape the ways in which these structures are actually changing, right? So how are we creating systemic change? Because me as an individual doula, let's just be real, you don't have that much power, right?
Right.
You like in reality, you come into a space, you're holding someone's hand, you're offering guidance, you're offering information, you know what I mean? But you're gonna come against roadblocks, and the roadblocks are not just, you know, not an individual provider type, but it's also like the institutional policies that are in place, right? And also, like what I've noticed within the work is that there becomes this underlying tension between like nurses and doulas and physicians and doulas. You know, this thing. And I'm like, no, like if we're all here to work towards a common goal, which is a healthy parent and a healthy child, then we have
and a good experience, right?
Right. And having that experience where, you know, you feel like you come out of it and you're like, yes, okay.
Yeah, it's not,
this
it's
was
not
it.
like you made it out, you survived. Meanwhile, you've got a
And that's not what it's supposed to be.
You've got trauma.
Right. So you're coming out of your experience, you're feeling like, excuse me, you're centered, your voice was heard, right? And you have the necessary supports in place as well. So one aspect is partnership development and growth. The other is understanding that community, you can't just say, okay, here, take this thing, and this is what your rights are. And then you go into a space and you expect somebody to be able to do that when the system is not set up for them to have those things. Because now you're setting them up for failure, right?
Mhm.
And so it's also looking at the ways in which community members are interfacing with community partners and institutions and really
Mhm.
bridging the gap in those. And so creating community advisory boards and then thinking about the social needs of the individual. If someone's
Mhm.
social needs are not met, then they're
Yeah.
not going to be as invested in, you
They
know,
can't be.
they can't because I'm in survival mode, right? If I'm thinking
Mhm.
about
Mhm.
how to get food, clothing, and shelter, right? I'm not
Right.
thinking about all of that stuff. So I may have a
Right.
delayed onset of care. I may have,
Mhm.
missed appointments, all of these different things. So then it's like, well, then how are we addressing those things? And some of the ways we
Mhm.
do that is we offer monthly giveaways where we give away groceries, we're giving away, essentials. But it's also to not create a dependency either,
Right.
right? So while we're doing this, we're also providing education and saying, okay, so now what are your goals? What do you want for
Mhm.
yourself? You know
Mhm.
what I mean?
Mhm.
Like, how are you
Right.
lifting yourself up so that you don't have to continue this same pattern or right or you don't have to find yourself in this situation again, right? Because I don't believe in like I've seen a lot of supports that have come up where it just creates a codependency, and
Mhm.
then once
Mhm.
that is gone, then what? Right? You leave you leave the person in the same place that they were in. I don't want to leave people in the same place that they were in when they first started. I want them to come out of it with an education, with the necessary supports. If you need housing, if you need food, if you want to go back to school, how can we make it
Here's
so
how to do it.
right, you can do those things. You know what I
Mhm.
mean? And you can
Mhm.
feel like you can feel empowered to want to do those things, right?
Mhm.
Because you have somebody who may be seeing you for the first time as an individual and not just as someone who is coming through the door.
Mhm. Excellent. Yes, that is exactly, and that leads us on to our next question. Your advocacy work that you have done that has really stretched far and wide. You've even met with Vice President Kamala Harris. So how was that experience and working on the Momnibus? Tell us some more. Can you share that experience with us?
Yeah, so Ancient Song and myself, we have been working on legislative policy on a city, state, and federal level for a while now. And I mean, I enjoy it. I love it. I'm a policy junkie.
It's like just a little bit. It was nice.
It. And some people are like, "What? You actually like this?" And I mean, I really, really do. And I've met some incredible individuals who are on the front lines for really wanting to shift the ways in which people are engaging with policy, the understanding of it. Even at Ancient Song, we have created, for community, the Birth Justice Institute, which is a policy fellowship, right? So that residents in New Jersey from across the state can get, if you are a grandmother, if you're a community activist, if you are working in maternal health, if you're a researcher, you can get a better understanding of like how do these levers actually work, right? How does a bill
Mhm.
become a bill? You know what I mean?
Mhm.
Like what are the different channels you have to go through in order to understand that? Because what I've realized is that when these doula bills and things would come out, there would be like all of this uproar, and people were like, okay, do this now and da da da.
Mhm.
But
Mhm.
if you don't understand the full mechanics of how all of these things work, then you don't know how to appropriately address them.
Mhm.
And so, being in the space and advocating for the Momnibus Act, the Mamas Act, working with Senator Booker's office, and others, it just has been a real pleasure because these are individuals who are truly invested in creating not just like, social reform for the moment, but like long-term systemic change, right? Who are looking towards what not just like having a bill, but what does the implementation of that bill look like? What does accountability look like? How are we holding, institutions accountable for the ways in which they are or are not providing services to our communities? And so, yeah, I mean, I really enjoy it, and working with, Vice President Kamala Harris was a joy. To be able to give insight and to provide, to talk about maternal health and what that looks like, and, try to find, again, creative ways for us to be able to address this, not just on, when we think about New Jersey is unique in and of itself, right? Because
Mhm.
New
Very
Jersey,
forward thinking. Mhm.
yeah, I mean, like, we're in a space where you have, if you're at one end of New Jersey, you can be very rural. If you
Mhm.
go to the other end, you're very like urban. you have, your suburban area. So we have a very dynamic ecosystem where we have the opportunity to really bring a perspective that is oftentimes missing when you're like working in, in New York City, for instance, right?
Right.
And so, I think that, us in New Jersey, we just have to really look at how we're, I don't want to say pushing radical change, but how we are putting the pedal to the metal and how we're holding the flame to the fire to really address, the things that we know are necessary within our institutions and within our communities so that we are not consistently in survival mode, right? And we're thinking about the foundations that we're laying for future generations. I mean, you asked me earlier what was one of the biggest sparks. My children are. I have 6 children. I'm a mother. You know what I mean?
Mm-hmm.
Like, I don't want
Yeah, I
them
think.
have to have these conversations. You know what I mean? Like, I want
Mm-hmm.
my daughters to feel like they are centered and affirmed in their reproductive health choices. I want my sons to be able to offer the necessary supports to a young lady, you know what I mean, when they decide
Right.
to get married, so that they can say, hey, I was there, I was able to show up in a meaningful way, and this is
Mm-hmm.
what I know. And you can only do that when, things are, when you have individuals like yourself and others who are willing to take, that next step forward and make the changes.
So when we're talking about people who are really not involved in healthcare making those transformational changes within their institution, it's really getting out there and being informed, voting, knowing what's going on, not only waiting to vote for president, but in your local elections, making sure that you're involved.
Yes, and
And
and as we're moving into the next climate of a different administration, folks really need to look at how we are looking at the state as a
mhm,
whole. You know what I mean? How are we codifying certain reproductive health rights within the state? How are we going to center ourselves as a blueprint, right, for other states to understand, like, okay, we understand what's going on in a larger body, right? But what does that mean for us creating a safe space for individuals within the state to get the necessary supports that they need? And this is for everybody, right?
mhm.
And when I'm speaking from a bipartisan perspective of understanding, like, I'm talking about, if healthcare is terrible for Black, brown, and indigenous women, well, what are white women experiencing?
Mhm.
Right? Because they're also facing a multitude of things, of obstetric violence, of feeling like their voices aren't being heard in spaces, right, of unnecessary cesareans as well. And so, like, thinking about that, right, we're talking about our maternal health landscape. It's not working for those who are most impacted, but it's not working for
It's
anybody
not
across
working
the
for
board.
anyone.
It's
Correct.
not working
Right.
for
It's
anyone.
just worse for us.
Right,
Yeah.
exactly. We're just feeling the brunt of it even more
Hmm.
than our
Hmm.
counterparts, but it's not working
Correct.
for anybody.
Hmm. Absolutely. So what initiatives does Ancient Song have upcoming that you'd like us to know about?
Yeah, so we have the New Jersey Birth Equity Task Force, where we'll be putting out applications this month for,
Is
again,
there a website where people can get involved?
yes, so you can go to ancientsongdoulaservices.com. And again, sign up for our newsletter. We'll be putting out applications, and that's for healthcare providers, researchers, professionals who are within the space. We're really leaning on how are we going to change, the landscape. What are the things that are important, the drivers to really building on the healthcare infrastructure that we have, but really making sure that those who are most disenfranchised have the necessary supports in place, right? We have the New Jersey, excuse me, the Birth Justice Institute, which has started. We have birth justice hubs all throughout the state, in South Central and Northern New Jersey. And these are
Hmm.
hub sites where people can come, they can get resources, they can get education, and it acts as a community feedback loop, right? And so real-time information for folks who are on the ground every day, who are accessing healthcare resources, really
Hmm.
providing information for us to be able to report back out and say, well, how is this actually working, right? Do people feel like they're really getting the supports that they need? Or is it just another initiative that is happening? And so, and then disseminating that to our partner organizations so that we can work together again to de-silo the work, because there's so many, institutions throughout New Jersey who are making a concerted effort to really change the way in which people access healthcare services. and meet the social determinants that people need.
Mhm.
And it's just a way for us, again, to be able to do that in real time. And then doula trainings, we offer doula trainings, doula services. Yeah, so people can, just go on our website, you can check us out and yeah, get the
And the website is,
it's ancientsongdoulaservices.com.
and I'm sure we'll have it attached to that. Right. So before we leave, I know we probably are over time, but before we leave, just a softball question. You've done so much
Yes.
in your short time here. If you were going to write a book, your time here now, what would the title be and why?
Off the top of my head, I would say centering intergenerational hope. And I would say that because I think oftentimes, or I've learned, I've seen that that oftentimes people toss around hope very loosely, right? And don't understand the connections between our ancestors, our grandparents, our aunts, our uncles, how they were a catalyst for the hope that we are standing in today. Like we are their hope. And essentially we are creating hope for the next generation. But if we don't take the opportunity um, to be bold, to be fiery, right? To stand up, to stand up for truth and rights, to really stand up for what it means to move from a humble perspective, but also know that we have a moral responsibility for one another as a collective community. I grew up in New Jersey, born and raised here, moved to New York, came back. And I remember growing up and I remember community. I remember what it meant for folks to be like, oh, you're so-and-so's granddaughter.
Right, exactly.
Like I remember like, all right, my neighbors knowing like who we were and you know what I mean? People checking in on other folks. And
Yes.
that wasn't that long ago. I'm only 45. Like that wasn't that long ago. And I want my children to be able to have those things. I think that that's important. Like I speak to my neighbor across. I'm like, hey neighbor, you know what I mean? Like
Yeah.
I think that those things are important. I think that oftentimes we've lost the essence of that and some of the things that I do. So, I think we have to remember that without hope, and understanding that we are the hope for the next generation, right? And we are the hope for the future generation, and we are creating hope for ourselves in the present. And if we don't hold on to that, you could easily become disillusioned by all of the things. So I would say, don't worry about all of the things. You know what I mean? Like everybody has an opportunity to do something with whatever they have. You know what I mean? And so we just have to take an opportunity to trust in that and to do it.
Wonderful way for us to end our segment. I'm so sorry we have to end, but that is just wonderful, a wonderful sense of community and hope. And I look forward to speaking with you again. And I look forward to seeing you next time. And thank you for joining us.